very exciting. This is the first proton therapy center in Arkansas.
There are actually many states that still don't have one. It's one of those treatment options that is not available widely, even throughout the United States.
Cancer patients have a choice in their treatment. Here at UAMS, we offer the most advanced technology, the most disease site expertise, as well as access to clinical trials.
With proton treatment, not only the cancer can be cured, your quality of life is significantly better with this type of treatment.
Proton Center of Arkansas is actually a team approach where we brought together 4 entities who are all interested in bringing proton therapy to the state of Arkansas, to the region, and providing it to international patients here in Little Rock. That team includes the University of Arkansas for Medical Sciences, or UAMS, the Baptist Health team, as well as the Arkansas Children's team, in conjunction with Proton International and the Proton International Consortium.
The Proton Center of Arkansas is in the new UAMS Radiation Oncology Center, which is our state-of-the-art facility located on the UAMS campus in Little Rock.
Having proton therapy available at UAMS is very important for cancer patients. Previously, patients who needed proton therapy had to travel out of state.
The thing about radiation is it's a daily treatment. It's given 5 days a week, and it's given often as many as 6 weeks. And so to be able to stay in Arkansas and get the best treatment possible, it's a huge deal.
Historically, the maximum tolerated dose is determined by what is near the tumor. So if you have a normal organ that's already received radiation, then you can't get further radiation. So the benefit of proton therapy is that you can still deliver that maximum dose with very minimal radiation going to those nearby organs.
That's where proton can be really, really helpful, like brain tumors, like head and neck cancers or lung cancers where they have received radiation in the past. Also for pediatric patients, since they're small, the radiation needs to be really accurate and precise.
So here at the Proton Center of Arkansas, we actually have the newest, latest, and greatest version of proton therapy called pencil beam scanning proton therapy. And really that allows us to focus the beam into a tiny pencil beam that stops inside the tumor, but then we can take that pencil beam and scan it across the area, almost 3D printing the dose inside a patient's body, allowing us to have the most targeting of radiation therapy really almost known to man, and really be able to vastly reduce the dose to surrounding normal tissues, and therefore not only set them up for a good cure rate and give them the most effective therapy against their cancer, but also vastly reduce the impact to them and the rest of their lifetime as far as cancer risks or any of the side effects that are associated with radiation therapy in general.
The great thing about UAMS and Arkansas Children's is the multidisciplinary tumor boards, which is an opportunity for the surgeons, the medical oncologists, the radiation oncologists like myself, the pathologists to get together and discuss all of the cancer patients.
We review the diagnosis, the radiology, the pathology, and come up with the treatment plan.
Once we decide that radiation and proton therapy is the right treatment for a patient, we'll have what we call a CT simulation. And we call it a simulation because it basically sets up the treatment. Typically takes us about 2 weeks to make a plan after that. And then once we start, when they first walk in the room, there's going to be a screen that they can actually kind of select the colors in the room. They can pick themes where they can see even things like Nemo, or they can be in Africa on the savannah and see the wild animals. So the idea is just to kind of take away some of the stress. They'll do some imaging each day to make sure that you and the target are where it should be. And then once that's all confirmed, they'll actually turn on the machine. It doesn't hurt. You may be in the room for about 30, 45 minutes, but once it's done, you get off the table and you most likely feel no different than when you got there.
I'm truly very proud to be part of this project, Make Proton Center.
It's the only center, but there's so many exciting things happening. There are a team of physicists, engineers, and they work day and night to make this happen. And it's so incredible to be a part of that team to provide the care using proton therapy.
For patients with a new diagnosis of cancer, proton therapy may be an option for their curative treatment. I encourage all patients to have that discussion with their cancer doctor, or if they would like to learn more, they can visit the Proton Center of Arkansas website or call our referral center to make an appointment.
This is truly something different from standard radiation. It is a privilege and an honor to work at this Arkansas's only Proton Center.